my L4 is knackered, had a microdiscectomy that failed, is likely they'll redo or fuse. One of the big misconceptions around microdiscectomies is what is even happening, right? What does failed mean, right? Generally speaking, unless surgery was done wrong, a microdiscectomy didn't fail. What it probably did, and what we mean by fail in Tyler's case, is that it failed to reduce his symptoms, right? And that's because the thing that's operated on is not the problem. And this is detailed, but it really makes sense, and it will hopefully help people like Tyler who feel like they've had a failed surgery. The purpose of the surgery, in your eyes, might well be different to the surgeon's eyes. The surgeon is there to correctly perform a surgery. That is, generally speaking, what a success is. It's worth actually having these lengthy discussions, if it's possible, with your surgeons to actually explore these kind of concepts. Hey, doc, we're doing this surgery. You're thinking it might help me. Why do you think I'm going to heal any better after this surgery as opposed to before? Why? Oh, well, Tyler, if we can just get that disc off your nerve, you're going to feel better, so you can do your rehab. And then you're going to make progress on your rehab. You're going to build objective strength, like we've been talking about at the start of the live session, and then you're going to be better. And then you're going to go on and you're going to do great. That conversation frequently does not happen, and that's the problem. The simple fact of the matter is that a lot of people don't have the capacity to get down to the point where we can pick something up off the floor. This is precisely why we're learning this, though. But you have to come in at the right level for the individual. So a storyteller might well only be able to do a squat to here and a hip hinge to here. Sorry, the floor's out of bounds at the moment. But as storyteller gets better and better and can squat better and better, and he can go lower and lower, or she can go lower and lower, and we can do our hip hinges with more mobility, and we're stronger, we can maybe even consider the idea of coming down on one knee. Or maybe we can consider the idea of coming down like so to pick up. So we don't need to round our lower back. What they're doing in that scenario is really, I would argue, more of a test. That's not rehab. That's just a test. Are you having to round your lower back to get down onto the floor? Okay, you are still. Fine. But that's not rehab. That's just a random test. And we don't want to do recurrent rounding the lower back just to practice getting down on the floor and rounding our lower back.